Good afternoon. My name is Mason Hochstetler. I am a PhD student in Dr. Swart Meecher's lab here at OSU CHS as part of the Biomedical Sciences program. Today, I'm going to present to you my poster entitled Xylazine Adulteration Modulates Heroin-Induced Behavioral Responses. Starting with our introduction, the United States is currently facing a severe crisis involving opioids and opioid use disorder. In 2023, opioids were involved in 55,529 fatal overdose deaths within the United States, as well as there was 126,674 reported non-fatal opioid overdose emergency visits. Now, while the drugs of opioids are incredibly dangerous and fatal, we also have the compounding problem of adulteration of these drugs where another substance is found present. In this case, we are a lab studying heroin and adulteration of xylazine. Now, xylazine, also known as tranq, is a non-opioid sedative that has no use in humans and is only primarily used in vet med as a sedation drug. Now, the problem here is that xylazine being a sedative and opioids causing respiratory depression as the main killer, you get this compounding issue of the sedation and the respiratory depression being escalated. So while heroin is very well studied, xylazine in the context of heroin is not. So our plan is to elucidate the behavioral effects of heroin when adulterated with xylazine. Starting with our methods, we used 32 male Sprague Dawley rats. We had 4 treatment conditions of saline, heroin, xylazine, and heroin-xylazine combo, which I will refer to as combo for the future. We then did 10 days of self-administration, a progressive ratio on day 11, and withdrawal recordings on abstinence day 1. And then we followed that with Q-induced reinstatement following the 10 days of an extinction protocol and tissue collection at the end. Starting with figure 1A, we have our self-administration across 10 days. And as you can see, the heroin group has a escalation of drug intake as compared to the other groups. Then we have figure B here, which is our inactive responses, showing that the animals were able to distinguish between an active response that produces their reward and an inactive response that does not give them a reward. Moving on to figure 2, our progressive ratio. A progressive ratio is a way to test motivation, and we do that by doing an FR1 schedule to start. So 1 nose poke equals 1 reward. And then from there, after they do that first one, they get FR2 for 1 reward, FR3 for 1 reward. So they have to work harder and harder to get a single dose of drug. So in this case, we are looking at our infusions. You can see here that the heroin is significantly higher than all groups, including the heroin-xylazine combo. Now, it is very much a small significance. However, the combo group is still higher than xylazine alone. And so what that is showing is that the combo group, while it is significantly different than the heroin, is still significantly higher than the xylazine, showing that motivational properties of heroin are still slightly present. Looking at figure 2B, we have our breakpoint, and the breakpoint is when the animal gives up. A breakpoint could be as high as like 192, where they have to nose poke 192 times to get a single dose. And as you can see here, the data is fairly similar, with the heroin group being significantly different than all other groups, and the combo group still being significantly higher than xylazine alone, showing that there is still some motivation, but it is definitely being decreased by the xylazine. Finally, we have our extinction and Q-induced reinstatement. In figure 3A, we do an extinction where we place the animals back in the exact same box they learned to take drug, but we remove a Q light and a house light that signifies that drug is available, as well as the drug itself. Over the course of 10 days, their behaviors are extinguished as they learn that they can no longer receive the reward by doing the same behavior they did previously. After that 10 days, on the 11th day, we reintroduce the Q light and the house light that taught them to take drugs, but no drug is present. And as you can see, there is no significance between the groups. However, there is a trending significance in the combo group over the xylazine and the heroin. And this is preliminary data, so we require adding a few more animals, which we are currently in the progress of doing that did not make it into this poster. Now, our future directions here, we plan to do this in female rats as well, as this was all male rats, and then examine the neurobiology of the brain affected by adulteration of heroin by xylazine, such as brain hypoxia and other problems, as well as looking at what regions of the brain are responsible for mediating the effects of xylazine adulterated heroin. We also recorded somatic withdrawal signs, and we got some significance in xylazine for hyperactivity, which hyperactivity is related to itching, scratching, and generally grooming, which xylazine has the ability to produce a very itchy effect and lesions on the body. But this is preliminary data, and we are still needing to add more animals to this study. Finally, heroin is a strong reinforcing drug. When adulterated with xylazine, the rewarding motivation properties of heroin are significantly decreased, and the drug combo group seeks drugs more, but not significantly so following Q reinstatement. Thank you.